representatives from our ministries of health, East African Federation chairs, representatives and directors, and all our guests, welcome. My name, as Faith mentioned, is Dr. Peter Kamunyo. Also a director at Kenya Healthcare Federation and East Africa Healthcare Federation. And I'm also a medical businessman. So that is part of the corporation, representing an organization known as MedSource Group Limited. It is my privilege and pleasure to, and on behalf of the Ministry of Health, our co-host for this conference, Kenya Healthcare Federation and the East African Healthcare Federation, to welcome you here today. We are delighted to have you with us and participate in this 8th East African Healthcare Federation Conference. Thank you for coming. That many of you have traveled long distances to be here serves as a reminder to us all how important healthcare and regional collaboration is. As of this morning, we had over 340 delegates already registered, and delegates from as far as Kazakhstan, Somaliland, Japan, Netherlands, Switzerland, Israel, Nigeria, South Africa, who are present with us today. Just a bit of history which Kama started talking about. On May 3rd, 2012, private health sector representatives from Kenya, Tanzania, Rwanda, and Uganda formally launched the East African Healthcare Federation in Kampala, Uganda. And our host then was Dr. Ian Clark. And since then, EAHF members have organized these annual conferences on a rotational basis in their own countries. In 2013, we moved to Tanzania, and AFTA was our host. 2014, it took place right here in this hall, and we were the host as KHF. 2015, we were in Rwanda. 2016, back to Uganda. 2017 in Dar es Salaam, and last year by our newest member then, Ethiopian Healthcare Federation, where they hosted us in Addis Ababa. So somebody asked me, why do you always just keep meeting? Are these meetings relevant? Are they useful? So besides hosting key regional private healthcare events, we are also making strides towards inclusive East African community policy, whereby the ease of doing business in the region will increase and healthcare investments and developments can prosper. So that is our goal, and through many interventions we are able, and we've made some significant progress. East Africa Healthcare Federation is not only committed to actively raising the quality of healthcare in the region and for everyone, but also to foster regional collaboration, one of the key buzzwords, and trade between member countries. We strive to make meaningful contributions towards achieving SDG 3 to ensure healthy lives and promote well-being for all at all ages. His Excellency, our President of Kenya, Uhuru Kenyatta, prioritized UHCs in the government's Big Four action plan, launched last year in January. And in tandem with achieving sustainable development goals, will be as much about the effectiveness of development cooperation as it will be about the scale and the form of it. Such cooperation will take. There's a lot of talk about partnerships, but I like what Manu said, it's not enough practical, on-the-ground support to make partnerships yet effective in practice. And this is imperative to catalyze the investments and funding from private sector required to bridge the funding gap towards achieving these goals. I was very delighted to hear what Professor Rogo said, that there's some $2 billion flowing this way soon for help to support healthcare. Working with the private sector means that areas of intervention need to create business opportunities and generate profit. It's not an ugly word. It's a word for sustainability. And this includes getting all the way to the rural and remote parts of our country. We always use, like Coca-Cola as the example of getting, product all the way to the last mile, and we're all acting surprised. There is no surprise. It's a value chain. What is the return for everyone who handles that product all the way to the end? And the day we figure that out, it will be very easy to get healthcare all the way safely to the last mile. We know what we need. We need money. We need people. We need supplies, and supplies to get to the right person at the right time. And as Manu said also, we need an infrastructure. And all this working in concert. Some practical ways, which I'm sure will be discussed during the conference, include embracing last-mile tech innovations, e-health, m-health, mobile diagnostic kits, drones, artificial intelligence, that turn difficult to implement ideas in our part into bankable propositions. Blended finance engineering and risk-lowering tools like impact bonds are also ways to mitigate risks of investing in these areas. We must be creative. This brings me to our theme this year, which is from strategy to action. And action is also one of those keywords that was mentioned by the panel earlier at the end. So from strategy to action, advancing health systems in the SDG era. It's time to roll our sleeves, hold hands, and act. An interesting feedback which has shown the progress that we have made since the first time when, even launching EAHF, trying to get onto the table of public sector, is that during the 6th Devolution Conference in Kenya, which was held in Kirinyaga earlier this year, our Honorable Cabinet Secretary for Health was seated on the podium with her. She whispered to me, asking, what does private sector want and what can they do? Please go back to your people and come back with at least 3 priority areas. That excited me a lot. Why? Because the government is saying, we want to work with you, but tell us. Don't just say we want to cooperate. Tell us specifically what you want. This clearly demonstrates the commitment for the public-private partnership, practical approaches. So during this year's 8th EAHF, it is my hope that the sessions that we have lined up, driven by all the experts in this room, will deliver candid and practical solutions and interventions to drive us towards achieving SDGs within the next 10 years. We missed the MDGs, only 1 or 2 or 3 countries around, Ethiopia being one of them, that were able to achieve. But we still have a journey that we can catch up to make sure we deliver the SDGs. So, ladies and gentlemen, prepare yourselves to be challenged, excited, and also inspired. So, taking this opportunity also to give special thanks to Ministry of Health, Farm Access, the World Bank, all our sponsors and exhibitors, and you delegates for making this possible. So I would like to take this opportunity to welcome Ms. Rachel Muthoga on stage. She's the Deputy CEO of KEPSA, and Rachel is an advocate of the High Court of Kenya with over 10 years' experience. She studied law in the University of Nairobi and took her master's studies in international legal studies with a focus on human rights in Washington, D.C. at Georgetown University. She was admitted as an advocate of the High Court of Kenya in 2006. She is the immediate former executive director at Moving Goalposts and has worked in a number of local and international organizations, focusing on development, financial inclusion. Rachel was recognized by the Business Daily in 2015 in their Top 40 Under 40 Women Award. So ladies and gentlemen, please put your hands together and welcome Rachel.